Good day everyone, this is Justine Andrei Velasquez and I'm here to rationalize the steps of offering a urinal. So, why offering a urinal is essential? It is to assess patients with their everyday needs such as urinating. So, voiding is essential to us is to let out urine from our body. Assisting patient is important to avoid the spillage of urine and soiling of bed lining. So the first step is prepare the materials. So preparing the materials, it helps us to save time and space. Next is do hand hygiene or hand washing, and after hand washing is to put on gloves. So it helps us to prevent contamination of microorganisms. Third, provide privacy. It is also important because it is a way not to make our patients uncomfortable. Helping the person using the urinal. So fourth, explain to the patient about the procedure so the patient can know what you are going to do and what you are going to touch in the genital area. Fifth, determine if the patient needs help in urinating to provide assistance such as giving and assisting the patient how to void like holding the urinal. This is a urinal. Next is assess the patient in comfortable position so the patient can urinate or void comfortably without hindrance. 7. If the patient needs assistance, hold the urinal for them. Position the urinal properly and gently. If assisting a female, help the patient spread her legs and cover her privacy. And if you are assisting a male, put the penis in the opening at the top of the urinal and cover for privacy. So with this, position the urinal properly for females. So place the urinal properly, placing the mouth directly or near to the vagina if you are assisting female. So example, this is the vagina. So you're like this. So the the urinal can scoop all the urine by the female patient. If you are assisting a male patient, you need to assist them with their penis. You need to assist them with their sample. This is the penis. You need to assess their penis in the mouth of the urinal to avoid spillage and splashing of urine when voiding. So next, when the patient is done urinating, carefully remove the urinal. Carefully remove the urinal because it can cause splashing and splashing the bed linings, the bed, or something that can touch the bed or contaminating the bed or something like that. After the person uses the urinal, do perennial care. Use damp washcloths or wet wipes for a woman. To be sure, wipe the area from front to back because how do you call this? The urine. This is the vagina. Sample. This is the vagina, and you're voiding here. We all know that that urine can slide down up to your butt. So you need to wipe it from front to back or into your butt. So it can be completely wiped. So it is to avoid infection or urinary tract infection and to prevent smell of foul odor came from the urine. Gently wipe it and make sure no urine is left. Next, dry the area between the patient's legs to feel comfortable and avoid itchiness like Like sa mga bata pa kay pilas. 12 is analyze and measure the patient's urine output. It is important because we need to be able to be alert when major problems that you may not notice from the physical exam. Also, urine output is a signifier of renal perfusion or something like your urine is healthy. So the post-procedure activity. So you need sample. Imagine there's urine in here. You need to empty the urinal into the toilet to avoid splashing of urinal in the surroundings. Also to avoid foul odor to spread and contaminate the area when you left the urinal everywhere. So you need to directly empty the urinal into the toilet. 14th is rinse and wash the urinal using a disinfectant diluted with water. Dry the urinal or let it air dry to completely clean the urinal, because if you're not going to clean it, microorganisms will always be trapped in here. And in order not to spread microorganisms. So 15 is take off your gloves and dispose it properly, and make sure not to touch the outer part of the gloves because contamination spreads quickly. Next is assess patient to do the hand hygiene, because sometimes from before I assess my Lola to wash her genital area, and sometimes she wants to do it herself. Then that's when I assist her to do hand hygiene, because she's scooping microorganisms. That's why we need to be alert and to completely eliminate the microorganism and avoid the contamination of germs. Next is aftercare. Clean and gather all the materials and return to its designated areas. Lastly, documenting. So it protects the patient and promotes qualified care, and to let other nurses know when the client is voiding, or when is the time he or she void, or is there something wrong with his urine, or is it red, is it light yellow, something like that.